Well, hopefully I won't go 10 minutes. I don't have any slides for you. I just want to explain a little bit about where I come from. I was classically trained in medicine and did my post-MD training here in San Diego. And that's where Dan and I met. I was one of his first instructors when he was in his residency or fellowship program here in San Diego. And as a sort of a counter to the science that we were hearing about in publications, we spent most of our time pursuing evidence-based care, and as medical oncologists, we are constantly taught about the amazing effects of the drugs that are on the marketplace, and I think many of you have heard about them, read about them, and I will say that we've made some tremendous headways in medical oncology, from treatment of Hodgkin's disease to testicular cancer, and even breast cancer has advanced dramatically thanks to modern chemotherapy. Probably about 10 years ago, I became just a little bit jaded by some of the science, so to speak, and began to look at some of the articles that are published in peer-reviewed journals a little more closely, and found that many of those articles are sponsored by pharmaceutical companies. And there is an intrinsic bias there that is very hard to get around. And these are companies with tremendous resources. And I do not want to suggest that we dispense with chemotherapy. I think it has a great value. But what I've begun to do is to look at each of these articles closely and try to understand what was the expectation going into the trial, what was the result, were there already negative results. It's very hard to find negative studies in the literature. They're supposed to be balanced, but they never seem to show up in my journals. So I've begun to be a little bit more circumspect. And then, of course, in geriatrics, which I see a lot of seniors, very difficult, obviously, to be able to give a potent dose of a cytotoxic drug to these people. And I quickly learned that I could do more harm than good for some of these patients, and found myself at a bit of a loss. All the training and all the drugs and all the radiation and all the surgery was quite remarkable in the textbook, and at conferences and drug company dinners we were so excited to see some of the things that were taking place. But at the bedside, I felt like I had to put the brakes on a bit and step back a little bit, and all of a sudden there was this big gap. Here I was, made the diagnosis, maybe I attempted treatment, maybe I was cautious and didn't attempt treatment. And there was my patient looking to me, the family looking to me for advice. What's the next drug? What's the next surgery? And I began to explore other options. My patients came to me and told me about other approaches, whether it was acupuncture, massage, or osteopathy, or what have you. And instead of saying, no, that can't be possible, that wasn't in my training, I listened, and I asked them to teach me, and they would bring me articles, very, very impressive articles. Maybe not quite the same journals that the ones that the drug company sponsored, but still pretty impressive information. And I asked them to simply share with me what they were choosing to do. I wasn't dictating their decision-making process. I just wanted to know. I certainly would speak up if I saw a problem. I'm not a big fan of Laetrile. If there are people out there who believe in it, I'm not going to criticize you, but I've read a lot, and it just seems that there are some concerns there. And I would look elsewhere, but there are many herbal products, many energy approaches, and so that was how I learned. It's not medical school. Nutrition alone was an hour in medical school. So out of 4 years, I got an hour on nutrition. My patients have taught me amazing things. I think the integrative field has advanced. I went through a bit of a personal change back a 2 or 3 years ago, and Kim actually guided me towards an individual who teaches mindfulness, something very foreign to healthcare providers. And I went to Italy to a retreat called The Art of Presence. And I expected it was going to be 20 oncologists, and we were all going to sit around and maybe chit-chat for a while. And maybe chant a few times, and then go drink wine at the monastery. They did actually have wine at the monastery, but anyway, I was the only oncologist. There was a pathologist from Brazil and a family practitioner from Puerto Rico, and the rest were Reiki therapists, acupuncturists, social workers, chaplains, nurses, all with way more training in integrative approaches than I had. And what I found interesting is they were all shocked that I was there. They thought, an oncologist, the guy who gets chemotherapy, what's he doing here? And all I asked them was, look, give us a chance. We're not all evil. We're not all looking to make people sick and lose their hair. We're all trying to learn from you. And so Kim has taught me a lot, not to mention the fact that she healed me in one treatment following a golfing injury. So I've learned to embrace these approaches and ask my patients to embrace these approaches. And one of the things that I promised myself at the end of this conference, two things. One was I would dress casually on Friday, so this is my casual Friday dress. And the other is that I would listen. And there is obviously an art to that. And I was not good at it. I still don't think I'm great at it. But I found that in the same amount of time I've given, 15 minutes, 20 minutes for a patient visit, there's always time to stop and listen. And that includes, obviously, that senior who's maybe failing with pancreatic cancer or lung cancer, what have you. And just sitting next to that patient and listening, or just sitting quietly, have found some of the most amazing experiences, connections perhaps, between doctor and patient. They still teach me. They seem to appreciate that even though, believe it or not, they're not getting any more time. They seem to think they are, but they really aren't getting any more time. So when you hear from physicians saying they really can't take the time to listen, it isn't true. They simply haven't tried. And so I've added that to my practice, and it's been quite enlightening. And the patients walk out of the office feeling they've gotten something. Maybe they didn't get chemotherapy. Maybe they didn't see their blood counts go down. Maybe they didn't have a better PET scan. Maybe they didn't live anymore. But they seem to feel a better connection to the healthcare system and better connected to integrative approaches. And with me respecting those approaches and willing to share those with them, they keep teaching me so I can have resources to offer them. I like to have up on my wall something about nutrition that they can get access to, something about physical activity they can get access to, and something about stress reduction, mindfulness, spirituality, so they can do these things themselves. When they're finished their treatment, or maybe they don't get treatment, these are the things they can do to participate in their care. It doesn't always take a pill. And I'd just like to close by saying that for me, it's an honor to be amongst integrative therapy people, because you come from healing in the oldest traditions. And allopathic medicine, maybe in China this is happening, but allopathic medicine came from those traditions. And science came along so quickly that we lost track of those traditions. And I think slowly, with groups like this, we're going to go back to that tradition and combine those approaches. And I want to thank you for participating.